Chairman McGovern, thank you for this great opportunity. On behalf of the Syrian American Medical Society and people inside Syria, we are thankful for organizing this important hearing. My name is Ahmad Tarakji. I am the president of the Syrian American Medical Society, a cardiovascular surgeon from California and born and raised in Aleppo. The Syrian American Medical Society, believing in highest moral and humanitarian values, and with that, we have established over the last few years more than 120 hospitals and clinics inside Syria, with the principle of providing dignified medical care for people in need. Last year, we served more than 2.6 million patients inside Syria and in the neighboring countries. We did that through supporting more than 1,700 physicians and nurses. Our services extends between Syria, mainly, and the neighboring countries between Jordan, Lebanon, Turkey, and Greece. Mr. Chairman, we continue to witness countless atrocities and blatant violations of human rights in Syria. As you mentioned, civilians and the civil infrastructures are targeted every single day. Chemical weapons are used against civilians ruthlessly. The siege tactic has been used as tactic of war, and people were starved to death. And as you mentioned, medical and food aid were denied to people in need. My hometown of Aleppo, over the last few months, have witnessed unprecedented violence against civilians. In the eastern part of the city right now, which is completely besieged, they have more than 300,000 people inside that part of town. 85,000 of them are children. They're being bombed, targeted, starved, and gassed to death. 2 weeks ago, in the neighborhood of Al-Sukkari, in the eastern part of the city, chlorine bombs were dropped on civilians, and that resulted in more than 150 casualties that were treated in our hospitals. The people inside Aleppo and the other parts of Syria believe that all of this action aims towards displacing them out of Syria, and that's punishment method used against civilians. As you know, last week also, convoys that were supposed to be heading towards Aleppo to help them out were struck by Air Force, again abandoning delivering medical aid and food to people in need. Over the last 4 years, we've documented more than 161 attacks using chemical weapons on the civilians inside Syria. That's towards the end of 2015, and those attacks continue. That's despite the UN Security Council resolution and other attempts to stop those chlorine attacks and chemical weapons attacks. In addition to that, we have witnessed constant targeting of civilians and physicians inside Syria. For SAMS alone, in 2015, we lost one physician every 2 weeks by attacks on healthcare facilities and on physicians outside of the healthcare facilities. That's for SAMS by itself. Since October, we witnessed increased and escalation of attacks on healthcare facilities to the point where in July, we witnessed one attack every 18 hours on a hospital in Syria. For SAMS by itself, in the month of August, we witnessed one attack on our hospitals every 2 days. That's unheard of. That's unacceptable. My colleague, my dear friend, Dr. Hassan Al-Araj from Hama, he was a cardiologist. He gave away his hospital and his family wealth to treat people for free in his town of Hama. To protect his patients, he suggested building a hospital in a cave in the 21st century. We spent a year building that hospital in that cave in Hama to protect patients. A few weeks after we launched the medical operation in that hospital, the cave hospital, and as he was leaving the hospital riding his car, a missile struck his car and he passed away from that, leaving behind his family and his patients. The use of siege as a weapon of war has also been particularly deadly. Hundreds of deaths were reported and documented in many cities all over Syria, between Madaya, Muaddamiya, Daraya, Aleppo, Al-War, and other towns as well. Not only that, even children were denied medical evacuations for no explained reason until they suffered from death or suffered from permanent disability. Back in July, a few months ago, a conjoined twin, were born in the besieged eastern Ghouta. Our field hospital over there contacted us, and we reached out to the international community trying to evacuate them from eastern Ghouta to Damascus, a distance of less than 10 kilometers. It took 2 weeks to get them out from besieged Ghouta to Damascus hospital. They were not admitted to the specialized children's hospital in Damascus. They were denied admission, even with their complicated condition. And then when they were in Damascus, we start arranging for their evacuation to get treated in specialized centers in the United States. The civil society in the United States was very generous and supporting, and we drafted a plan to evacuate the kids from the Syrian borders all the way to the United States and get them pro bono treatment. This is what we believe in. For 2 weeks, their evacuation was denied. They were completely blocked off any communication with their families, with their doctors. Even I picked up the phone and called Damascus, asking for somebody who's humane and brave enough to say, yes, we will help you. But got no answer. At an age of 1 month old, both of them died. They could have been easily saved. They have nothing to do with any political conflict. That story continues on and on and on in Syria. In the city of Madaya, a few months before that, 3 boys, aged 6 and 7, were playing in their neighborhood. And they found a toy on the ground. They picked it up, and one of them found that this was a landmine. Horrified, he dropped it. An explosion happened, took the life of the first one. The other 2 were severely injured. They were evacuated to our hospital in Madaya. That's the only hospital that serves 40,000 people in the city of Madaya, where we've seen the starvation, people dying over there. For the next 24 hours, we begged the international community over and over and over, please evacuate them to any hospital in Damascus, less than 5 kilometers away. They could have just walked it if they were healthy. And after 24 hours, with no response, no intervention, nothing, they passed away. Yet for all humanitarian actors seeking to help improve the situation, there continues to be major obstacles to providing aid and relief to these besieged areas. The UN, for all of its efforts and good intentions, has been subjected to attempts by the Syrian government to determine the distribution of aid, even though there's a Security Council resolution and mandate which allows their agencies to operate without government consent. As you know, the convoys were stripped from necessary food and medical aid that's needed for people. The convoys were blocked from reaching their final destination, and recently they were struck and burned. The UN, with the backing of the broader international community, must retake control of aid distribution and use their full rights and powers as delegated by the Security Council to ensure a transparent, efficient operation. Mr. Chairman, in just the past few minutes, I've already relayed countless humanitarian rights violations that the people of Syria face every single day. They do not deserve this suffering. Nobody deserves this suffering. I would like to make the following recommendations. First, Congress should call on the administration to work with the Security Council to establish an independent third party to supervise and document aid distribution. Second, medical evacuation processes in Syria should be revised to establish new protocols in which the process of medical evacuations remains transparent, compliant with international humanitarian law, and is not subject to political negotiations or the influence of parties to the conflict. Third, Congress should pass a resolution calling on the UN government and the UN Security Council to refer perpetrators of chemical weapon attacks to the International Criminal Court. And lastly, given the systematic nature of the attacks on hospitals in Syria, we call for an independent investigation that's designed to identify and assign attribution for such hospital attacks. As you said, Mr. Chairman, this is a critical moment for action. Together, we can work to ensure a better future for the people of Syria. Thank you for the opportunity to testify today.